Hello and good afternoon. My name is Laurie Clabo. I am the Dean of the College of Nursing and the Wayne State Chief Health and Wellness Officer. Thanks for joining us this afternoon for our campus town hall. Before I introduce our guests for today, we'll, as usual, start with an update on where are we in Michigan, in the city of Detroit and on campus. The positivity rate in the city of Michigan, in the state of Michigan, is slow to recover from the Delta variant wave. And we're a little behind the rest of the country where we are seeing rapid declines in the number of cases. In the state of Michigan, positivity rate this week is still 12.1. In the city of Detroit, it's much better. The positivity rate, or the percentage of COVID tests that are returned as positive, is 3.9%. And on campus, we are also 3.9%. The city of Detroit still has a weekly average of 182 cases per 100,000 population. And as always, we are hopeful. The marker for that is we hope to be below 100. We're still not there. So still classed as an area of high community transmission, which is why we have extended the mask mandate through mid-November. The Campus Health Committee will look at that spread rate again, but as long as we stay in an area that the CDC has designated as an area of substantial or high transmission, we will likely extend the mask mandate another 4 weeks. The campus COVID vaccine mandate continues for winter 22. Anyone who is a faculty or staff member is required to be vaccinated or to have an approved waiver of the vaccine mandate for the winter 2022 semester. Students obviously required to be vaccinated or have an approved waiver if they are taking on-campus classes or intend to be on campus. Also, all members of the campus community are required to have a flu vaccine or an approved declination. And just a reminder that the deadline for flu vaccine has passed. And at the end of next week, we will be giving people last warnings on screeners that it's time to make sure you get your flu vaccine. So please, if you have not done that, make sure that you get yourself an appointment. They're available at the Campus Health Center, at clinics set up, flu clinics set up by CHC around campus, and always at local pharmacies. So today, I want to introduce our the two people joining me are also two members of the Campus Health Committee. First, Dr. Tina Chopra. Dr. Chopra is a professor of medicine in the Division of Infectious Diseases at Wayne State and the corporate medical director of hospital epidemiology, infection prevention, and antibiotic stewardship at the DMC. Her research interests include epidemiology of healthcare-associated infections, infection prevention, antibiotic stewardship, and immunization. Dr. Paul Kilgore is an associate professor in the Department of Pharmacy Practice and associate professor in the Department of Family Medicine and Public Health Sciences in the Wayne State School of Medicine, as well as senior investigator in the Henry Ford Health System Global Health Initiative. He's an internal medicine physician and epidemiologist by training. He's worked at University of Michigan Hospitals, at the CDC in Atlanta, and the International Vaccine Institute in Seoul. His research, teaching, and service has focused on infectious disease and vaccine research for the past 22 years. So thanks, Dr. Chopra, Dr. Kilgore, for being with us today. We have lots of questions from the campus community, so I'm going to dive right in. And Paul, I'll start with you. Lots of questions about boosters. So who should be getting a COVID-19 booster shot now?
Well, thank you very much, Dean Clabo, for having me here today. For individuals who received a Pfizer vaccine or Moderna COVID-19 vaccine, The following groups are now eligible for a booster shot at 6 months or more after their initial series. And the initial series means that they've gotten 2 doses of either vaccine. So the groups are anyone who's 65 years of age and older, anyone who's age 18 who may be living in a long-term care facility, anyone who's 18 and over who has an underlying medical condition, anyone who's 18 and older who may be working or living in a high-risk setting. And then for those who have gotten the Johnson & Johnson vaccine, booster shots are also recommended for those who are 18 and older and who were vaccinated 2 or more months ago. And that's really available now. So you can actually get it. I got mine last week. And so you can do that. And they're available in many, many places around Detroit and Michigan.
Including the campus health center.
Yes.
So you had your booster last week. Next question is, what side effects can I expect when I have my booster shot?
This is a great question. So they've been following up people who have gotten the booster dose, and in a population of more than 12,500 people who completed the survey, about 79% of people report local reactions. So that means things like itching, pain in the injection site, maybe some redness. And then systemically, about 74% had reported a reaction. So that includes things like fatigue, muscle aches, headaches, low-grade fevers. And that's typically occurring in the day after the shot. We see people recovering quite quickly after that. And so the adverse events or the side effects we see after the booster are very similar to what we see with the first 2 doses.
Lots of chatter about this mix and match approach to being boosted. So one of the questions we received is, if I got J&J, should I stick with getting a J&J booster, or should I consider getting one of the mRNA vaccines?
Right. This is a great question. So the CDC has approved the mix and match approach, and that really follows an earlier report from a NIH-sponsored trial that showed that it might be better for J&J recipients to get an mRNA vaccine booster from Pfizer or the Moderna vaccine. Now, these trial data are preliminary, and we're expecting more follow-up and more participants and more data from these studies. But one of the things that we know is that those who had gotten the J&J vaccine followed by a Moderna booster had a 76-fold rise in antibodies in 15 days. Now, those who got the Pfizer vaccine saw a 35-fold increase, and those that got the J&J booster had a 4-fold rise. So there is some evidence right now, it's preliminary for sure, but there's evidence suggesting that that mix and match approach is beneficial. And what's intriguing about this is that the J&J vaccine may actually trigger a different part of the immune system, stimulating not just neutralizing antibodies, but also the T cells, and that could result in more durable protection. So the NIH study is going to be looking at the T cell response in these combination approaches. I can tell you from my personal experience, I went out this past weekend, got my booster, and the place where I went to go get the booster in the online appointment calendar wouldn't allow the mix and match. So different places have different policies. So if you want to mix and match, you may want to check on that before you schedule your appointment or when you schedule your appointment.
One last question while we're talking about boosters and the need for booster shots and immunity achieved by booster shots, and a ongoing discussion especially on social media, about natural immunity, and why is natural immunity from having the disease, from recovering from COVID-19, not recognized as a substitute for immunity gained by immunization?
Yes, this is a very common question, and evidence now that we have is emerging that people get better protection by being fully vaccinated compared with having had COVID-19 illness. In fact, one study showed that unvaccinated people who already had COVID-19 are more than 2 times as likely than fully vaccinated people to get COVID-19 again. So together, vaccine experts and researchers really who are studying the vaccine and the disease agree. Natural immunity will not protect you against COVID-19 as well as an mRNA vaccine. Even if you've already had COVID-19, you should still get vaccinated. And because it's possible to get reinfected and get COVID-19 again, and it can cause severe medical complications, CDC is also recommending for folks to go ahead and get the COVID-19 vaccine, even if they have had COVID-19 illness in the past.
Thank you. Dr. Chopra, so lots of questions as well about the flu. So what do we know about predicted forecast for this winter in terms of flu and the interaction of flu and COVID-19?
Sure, that's a great question. Flu every year, as we have seen before the pandemic, kills thousands of people annually. But this year, during the pandemic, because people were masking, we did not see a lot of flu in 2020. But as the masks have come off, people have been vaccinated. We are beginning to see an uptick of flu, influenza B in particular. And as you are aware, flu also causes viral pneumonia, on top of which you can see bacterial pneumonia as well. And both COVID, the SARS-CoV-2 virus and the influenza viruses, they attack our respiratory systems. And if they are present together in the form of a twindemic, it can play havoc on our pulmonary systems and can cause severe lung damage. So hence the importance of getting influenza vaccination as early as possible, because we don't want to get really sick with co-infections from both flu as well as SARS-CoV-2 viruses.
Thank you. So we know that the deadline date for influenza vaccine on our campus was the 20th, and we've been giving people a little bit of grace in fulfilling that mandate. But from a health perspective, when is it too late to get my flu vaccine?
It's never too late to get flu vaccine. We are in the midst of the flu season. Children have gone back to school. There is going to be increased transmission when the air is drier and it is colder. The transmission is higher. So it is never too late to get the flu vaccine. And I would urge everyone to get it as soon as they can.
And we certainly know that the sooner people receive the vaccine, the more they're likely to be protected in these first waves of influenza A and B circulating in the U.S. Am I correct?
Absolutely. That's
So,
absolutely true.
Lots of people are thinking about their kids now, and with increased access to COVID vaccine for children. Someone says, my kids are due for their flu vaccine, and I also want them to get their COVID vaccine as soon as they can. Which one should I be which one should I be prioritizing? And is there some kind of a waiting period between the two shots?
That's a great question. So as per CDC, you can get both the shots at the same time. There is no waiting period as long as they are on different sites. Both of them act differently. So there is no interference with the antibody response with either of the vaccines. So they can get it at the same time. Both the vaccines are extremely important for children because as we talked about the cold weather, the air getting drier, the children being back in school, influenza and COVID and RSV are three very commonly seen viral infections in children, which can lead to high morbidity and mortality. And hence, it's extremely important that they get both the shots.
And we're giving at Campus Health Center, I know, obviously adults, not children, but lots of booster shots and flu shots at the same time. Many people find it pretty convenient to get both of those things accomplished in one fell swoop. I got my booster and my flu shot at the same time at the Campus Health Center. And I know that our local pharmacies are doing the same thing. Thank you for that. Let's see. Dr. Kilgore, given the small sample in the Pfizer trial for 5 to 11-year-olds, would you recommend that I wait a little while before I choose to get my own children vaccinated?
So, Dr. Dean Clabo, it's really notable that in Michigan, as of yesterday, 237,000 children in Michigan alone, it's almost 250,000, have experienced COVID-19. Given the risk of COVID-19 in children, and then weighing this against the risks and benefits of vaccination, I really would urge parents not to wait on getting the vaccine for their children ages 5 to 11 years. Because the CDC and FDA are tracking use of this vaccine very closely and in real time, we will learn quickly about any potential events that would tell us that this vaccine is not safe. The Pfizer study in children 5 to 11 years had 1,518 children in the vaccine group, 715 children in the placebo group, for a total of 2,268 children. The overall efficacy of the vaccine in these children in this study was high, 91%, and the local and systemic events were well within the accepted and expected range. This is why both the FDA committee and the CDC committee voted in favor of the vaccine use for children ages 5 to 11.
This is a question that continues to come up. Will giving children COVID vaccine harm their fertility, their future fertility?
Absolutely not. In fact, there's no scientific evidence from all the preclinical studies, the clinical trials we've done, using any of the 3 COVID-19 vaccines that are now approved and licensed, to suggest that these vaccines cause any damage to the female or male reproductive system or organs. We also know that there's been no adverse events or effects on pregnancy as well. So the bottom line is no harm to a child's fertility.
Dr. Chopra, we know you have a young daughter, and I know Dr. Kilgore's already weighed in on this, but someone asks, I'm a bit unsure about getting my children vaccinated when it's available. How do the benefits outweigh the risks when most kids aren't getting that sick from the virus anyway? Can you talk to us about that thought process there?
Sure, that's a great question. Children, I think what we need to be aware of the fact is that, yes, children are getting mild to moderate disease, but after several weeks of getting COVID, they are getting a severe disease, a severe inflammatory response in the form of multifocal inflammatory disease, where different organs of their body are being affected, and they are coming and being admitted to the hospitals in the ICUs. We are seeing an increased admission for this. This syndrome is called MIX, and this disease affects their heart, it affects their kidneys, it can affect their brain, their cognitive function, and they are pretty sick. These children are in the ICU at our hospitals. And if we are vaccinated, if we can vaccinate our children, we can prevent this severe form of COVID that we are seeing in children. So definitely the benefits outweigh, and there are no risks. As Dr. Kilgore rightly mentioned, in the studies, there is a 17-0 vote by the FDA as well as CDC in approving this vaccine. It is highly safe. It has gone through a rigorous process of safety and efficacy data. And I think that given the fact that the virus itself is causing such severe complications, there is no harm on getting a single shot. It is worth a shot.
And I think many people have been thinking about what having their children vaccinated means for their family. So less risk that a child then transmits an asymptomatic case of COVID to an immunocompromised grandparent, a safer family overall.
Absolutely. We've had cases of children bringing mild cases or very, very mild cough, and but presenting at home and giving COVID to all of the family, including grandparents, like you rightly pointed out. And I have personally taken care of a grandparent who was very sick in the ICU because their grandchild went to school and was able to transmit it to the rest of the family.
So lots of people are being extremely careful. And many of us, when we experience any symptom now, mild sore throat, think, could this be? And people are seeking out lots of means for COVID testing. So one of the questions we have is, how reliable are those at-home COVID tests that I can order online? Can I trust their results?
That's a great.
I'll start with you. I'll ask you both.
Sure. The at-home COVID tests are very convenient for the community. They are very convenient, particularly if children are going to school and they have been exposures to at school. But definitely they can have a high false positive rate, and they have the interpretation of these tests has to be done in the right setting, which means was there an exposure? Do they have symptoms and things like that? So they have some advantages, but definitely they don't match up to the PCR test, which is highly, sensitive as well as specific.
Dr. Kilgore, anything to add to that?
Yeah, I think people should do a little bit of research and homework on their own, taking a look particularly at the CDC website that has some new information there on a regular basis, and just pay attention closely to the kit and also the instructions when they look at the kit, making sure that they collect the sample correctly, and making sure that if they do a swab at home, to make sure that they do a swab according to the directions in a very, very thorough way, just to make sure that they get a good sample. One of the things that we found when we do these tests is that an incomplete sample or a poor sample collection can be a very important rate limiting step on the accuracy of the tests. Many of these tests have gone through rigorous evaluation. They're looking pretty good right now with sensitivity and specificity that's pretty high, like over 90%. And the PCR tests and antigen detection tests are there and available. So I would encourage people to try them and also look at their own research and online as well.
Thank you. So all of us spent the holidays alone last year. Many of us spent the holidays alone last year. What are we thinking about traveling? How safe is it to travel, to visit family and friends this year, to gather with families locally, if we're all vaccinated? So thoughts?
Yeah, I can begin, and then Dr. Kilgore can add. I think that it is a little bit different this year with vaccines around and also boosters around. So I would say that people who meet criteria, who are eligible for boosters, if they are boosted, it is very safe for them to travel. Unboosted eligible people should get boosted because it is going to give them immunity and it is going to give them safety to travel. Also, I advise that people should now begin getting their children vaccinated so that families can travel together. And as long as they are masked and they keep their social distancing and they avoid crowded places, I think it is safe for them to travel.
I agree 100% with what Dr. Chopra just mentioned. And I would just add one more thing. If you are getting on an airplane to travel during the holiday season this year, I would keep doing all the things that the regulations tell us to do. Number one, wearing a mask. Number two, great hand hygiene, and making sure that you follow the guidelines that you have on the airplane. And then also making sure that whenever possible, you can keep your mask on if you're not eating or drinking something on the airplane. And that way, I think it'll help reduce transmission in addition to getting the vaccine.
Thank you. Thank you both. We also have some questions that relate to campus health policy, and I'll take some of those. Why are masks still required indoors on campus when everyone's required to be vaccinated? And I think one of the things we've learned is that masks are an important adjunct to vaccine in limiting transmission. And as we said earlier, we've chosen to follow the CDC guidance, which suggests that indoor masking in public places is strongly recommended in areas where transmission is either classified as substantial or high. And so we're going to continue to watch community transmission in our local region and make mask decisions about our campus behavior on the basis of that. Let's see. If a student is attending in-person classes and tests positive, what's the protocol and notification process for faculty and students in their class? When the campus health center becomes aware of a positive case in a member of the campus community, the most important thing someone can do is fill out the daily screener. If you have symptoms, if you've had a test and you test positive, fill out the daily screener, even if you're not intending to come to campus. Once the health center receives a screener that suggests that someone is presumptive or positive, they will begin the contact tracing process. And if a student is identified as a positive case, the campus health center will reach out to that student. We'll do a CDC-derived screening process known as contact tracing, and they will talk to this person about their activities beginning 48 hours before their symptoms or 48 hours before their positive test. Talk about who were they around, what did, who did you have breakfast with, how long did you talk to Mary Jo, how far apart were you from each other, and they will identify during the period of transmission a list of what the CDC classes as close contacts. That means people who were within 6 feet of each other, with or without a mask, for a cumulative total of 15 minutes over a 24-hour period. And the campus health center tracers will reach out individually to people identified as close contacts. Close contacts, if they are fully vaccinated, are not required to quarantine. They are asked to get a test for 3 to 5 days after the exposure and to monitor themselves for symptoms for 14 days on the campus daily screener. For those who are not vaccinated, who were a close contact, those people will quarantine for a 14-day period. That period can be shortened to 7 days with a negative test that occurs between day 5 and day 7. So all of the folks who are close contacts are going to get individual notification. Faculty are going to be notified that there was a case in their class. We don't reveal people's names or identities to protect their private health information. And those who were in that class who were not identified as close contacts, others on campus who may have had contact but not significant contact with that person, will get a more generic email that says there was a person in your class who tested positive. While you were not identified as a close contact, we would encourage you to monitor yourself for symptoms over the next 14 days, and folks do not need to quarantine. So that's what happens if somebody's in a class. If I'm vaccinated and masked, but it turns out that I was a close contact to someone who tests positive, should I still get tested? I think we just kind of touched on that. If you are fully vaccinated, masked, and have no symptoms, you do not need to be placed in quarantine, but you may want to consider having a test at 3 to 5 days after the exposure, even if you're asymptomatic. Let's see. Oh, someone asked, where can I find information on what the numbers of cases and the positivity rate on campus are? That's a really good question. And we publish that data every week. It is on the Campus Health Center website, and it is health.wayne.edu/coronavirus-tracking. It's published every Monday for the prior week, and it's up by noon or so every Monday. And you can also find on that page the link to a PDF that goes back to tracing since March of 20, when the pandemic first began. So data published every week. I'm noticing that it's 1:29 already. I want to thank Dr. Chopra, Dr. Kilgore for joining us today. As always, a wealth of really good data-based information and also their tremendous clinical expertise. So we're really really grateful to have you both with us, not only today, but for all the work you do every day as members of the Campus Health Committee, and your commitment to keeping our campus safe. We're really, really grateful to both of you. This is probably our last campus health town hall before the Thanksgiving holiday. So we encourage all of you to think about making your plans for safe travel over Thanksgiving. And on behalf of all of us, wish you the happiest of Thanksgiving holidays. Thanks again for joining us today.
Thank you, everyone.
Thank you.
Bye.